Good afternoon, everyone. I'm Dr. Brenda Hemmelgarn and Dean of the Faculty of Medicine and Dentistry. Thank you all for joining us at the University of Alberta for this announcement today. In particular, I want to thank the Honourable Jason Copping, Minister of Health, and the Honourable Demetrios Nicolaides, Minister of Advanced Education, for being here with us this afternoon to share this news. And to my colleague and friend, Dr. Todd Anderson, Dean of the Cummings School of Medicine, thank you for joining us. Before I begin, I want to respectfully acknowledge that the University of Alberta is located on Treaty 6 territory. This is a traditional gathering place for diverse Indigenous peoples, including the Cree, Blackfoot, Métis, Nakota Sioux, Iroquois, Dene, Ojibwe, Saulteaux, Anishinaabe, Inuit, and many others. I am grateful for the ways in which their histories, languages, and cultures continue to influence our vibrant community. And now I'd like to introduce the Honourable Demetrios Nicolaides, Minister of Advanced Education, and welcome him to the podium. Thank you for joining us, Minister.
Well, good afternoon, everyone. Dr. Hemmelgarn, thank you very much for the introduction. And thank you, everyone who's here joining us today. It's a real pleasure, as always, to be back here at the University of Alberta campus, making a really important and exciting announcement with respect to healthcare education in our province. Again, thank you as well to my colleague, Minister Copping, our Minister of Health, and Dr. Anderson with the Cummings School of Medicine at the University of Calgary. You know, the last time I was at an event with both deans, we were announcing efforts to expand rural physician training opportunities in Alberta. At that announcement, we shared that it was just one piece of the government's larger strategy to improve Alberta's healthcare system. And I'm excited to be here today to share more of that plan and more specifically talk about how Budget 2023 will strengthen our province's healthcare sector for many, many years to come. As I said at that time, and I've said again in the future or in the past, advanced education plays a critical role in supporting our economy. When we ensure that learners can access the programs and training they need, we end up with a highly talented pool of graduates who are ready to join the workforce. This gives confidence to business and industry to move forward towards a future of growth and prosperity, knowing that labor needs are met. We're also guiding students to rewarding and successful careers. It is just as important to apply this thinking when it comes to addressing labor needs in our public sector as well. We know that students are more likely to stay and work in the same communities they study in. However, there is a lack of access to physician training. I have heard from many of my own constituents that their children aren't being accepted into physician programs in Alberta, even though sometimes they have mid-90 averages on their grades. The reason they sometimes can't be accepted is that program demand is very high. We end up losing many prospective medical students to other universities because our programs are at capacity. To give you some detail and context, in fact, over 3,500 qualified applicants in health programs could not be accepted this past year alone, with over 2,000 of those being qualified nursing applicants. Furthermore, qualified applicants at the U of A have increased from 1,156 in the fall of 2017 to 1,400 in the fall of 21, and similar increases have occurred at the University of Calgary. Of course, these programs are at capacity because of the high quality of education we know both the University of Alberta and the University of Calgary deliver. These schools consistently rank as some of the best in the country and best in the world. But we need to create more opportunities for these highly skilled students if we want to ensure that if we want to ensure the strength of our healthcare sector. Furthermore, Alberta has the best frontline healthcare workers in the world, and we must continue to take action to ensure that we continue to train and retain workers right here at home. And so with that, I am very pleased to announce that as part of Budget 2023, Advanced Education will be investing $72 million to train more nurses and doctors right here in our incredible province. Simply put, we need more doctors, nurses, and healthcare professionals, and our investment will help train the staff that we need to ensure Albertans can get into the program of their choice right here at home. Let me talk a little bit about how this funding will be used. First and foremost, $19.5 million will support new seats in physician training programs at the University of Alberta and the University of Calgary. $2 million will be provided for the 23-24 academic year to create 20 new seats at both universities. $5.8 million will be made available in 24-25 for an additional 40 new seats, and $11.6 million in 25-26 for 60 new seats. This funding and the seat distribution is based on proposals provided by the U of A and the U of C. By the end of 3 years, this will result in an increase of approximately 34% of physician seats, getting more doctors into our communities. The larger proposal, however, is a 10-year plan, and with this plan, we will increase physician seats in our province by 54%. Secondly, we are expanding on historic targeted enrollment expansion that we began last summer with an additional $30 million over 3 years to create more seats in healthcare-related programs. More specifically, we aim to create 1,800 new spaces in nursing, healthcare aid, and paramedicine programs. My department is accepting proposals currently from post-secondary institutions for this expansion. In the coming weeks, I'll have more details about how many seats are being created and in which programs. To note, in Budget 2022, we were able to create already over 2,500 new seats in healthcare programs across the province with an original investment of $26 million. And finally, for internationally educated nurses, we are investing $15 million to create new bridging programs. This investment will help create 900 new seats for internationally educated nurses studying in Alberta. This is in addition to an investment of $7.3 million previously made to expand existing bridging programs. That $7.3 million investment will create 256 new seats for bridging programs at Mount Royal University, Bow Valley College, and Norquest College. In closing, through this series of strategic investments, we are getting more doctors, more nurses, and healthcare professionals trained right here in our province. Learners will have more opportunities to study in the program of their choice, closer to home, and be ready to provide Albertans with the healthcare they need when and where they need it. This is a long-term solution that will benefit our healthcare sector and our province for years to come. I look forward to sharing more details on the targeted enrollment expansion once we've received those final proposals, so stay tuned for more to come. Thank you once again to the University of Alberta for hosting us today and for being a leader in delivering exceptional and high-quality healthcare education. Thank you.
Thank you, Minister Nicolaides. I'd now like to invite Minister Copping to the podium.
Well, thank you so much, Dr. Hamelgard, and good afternoon, everyone. It is truly a pleasure to be here at the U of A, and I'm happy to join Minister Nicolaides as we announce additional supports for Alberta's health workforce through Budget 2023. And once again, Minister, thank you so much for your investment in healthcare. It is so needed, not only in Edmonton and Calgary, but across our entire province. And the investments that you are making through advanced education and through U of C and U of A to be able to deliver the programs will truly help put our province in good stead so that Albertans can get the health care they need where and when they need it. This budget addresses key areas of the healthcare system, specifically pressures facing our healthcare workforce. Today's announcement is another part of the health workforce strategy I announced with Ministers Madu, Jean, and Sani last month. And it builds on the great work that is already underway to increase the number of healthcare professionals here in Alberta. We added 254 physicians and 800 registered nurses, licensed practical nurses, and healthcare aides in 2022. Since 2019, AHS has added 5,800 frontline staff, including 1,800 registered nurses and 300 paramedics. And while we're turning the corner and making great progress on adding workforce supply, today's announcement is to say we're doing even more. Physicians are the cornerstone of our healthcare system, and Alberta's government appreciates the tremendous contributions they make on the front lines of our healthcare system each and every day. Our ability to recruit and retain doctors is a top priority for our government. One of the best ways to do this is to make sure that there are more opportunities for Albertans to train and work closer to where they live. If we train more Alberta medical students here in our province, they are more likely to stay once they have completed their training. Last year, the University of Alberta and the University of Calgary approached the government with a proposal to meet this need. We thought it was a great idea and helps address the long-term need for doctors throughout the province, particularly in rural areas. So in addition to the undergrad medical seat expansion Minister Nicolaides has just announced, Alberta Health is investing $113 million over the next 3 years to fund the corresponding medical residency positions through the Academic Medicine and Health Services Program. This includes the necessary supports to expand the ability to train more doctors, particularly in regional centers and rural communities. This expansion of the training program ensures that med school graduates have the residency opportunities needed to be able to fully practice. We also know that when medical residents can train in rural areas, they're more likely to stay in those areas. And we want to offer those training opportunities so local students can stay closer to home. Our investment on top of this also includes 30 additional residency positions for international medical graduates who need more training before they can practice here in Alberta. The medical residency expansion also supports the development of regional health professional training centers in Lethbridge and Grand Prairie. And this was an announcement that we made a number of weeks ago with Minister Nicolaides in terms of ensuring that we can get clerkships and residencies in other areas outside of the big cities, Calgary and Edmonton, and the starting point is Lethbridge and Grand Prairie. Now, these centers will serve as hubs for clinical teaching, program administration, and networking for rural medical education in the surrounding rural communities. By adding more medical seats at the front end, it sets the stage for more physicians in the pipeline to meet Albertans' health needs in the years to come. Once the seat expansion is fully realized, we expect Alberta will be producing approximately 100 more physicians each and every year. Budget 2023 investments being announced today will have a direct impact on increasing the number of health professionals to support Alberta's healthcare needs. This is a cornerstone of our new health workforce strategy, a strategy that lays the groundwork for a resilient and sustainable healthcare system that provides every Albertan with access to health and a health home. This cross-ministry strategy was developed through heavy consultation and the input of 5 ministries: the Ministries of Advanced Education, Skilled Trades and Professions, Trade, Immigration and Multiculturalism, and Jobs, Economy, and Northern Development. All have been strategic partners to make sure this health workforce strategy provides a sustainable framework for the future of Alberta's health care system. And these continued consultations will strengthen a collaborative and supportive working environment that meets the needs of Alberta's healthcare workers and those that they serve. The strategy will support the health workforce in providing the highest quality of care to Albertans. And we're releasing the full strategy on our website today, so I encourage everyone who has an interest in our healthcare workforce to go and take a look. Today's investments, together with the actions we're already taking to address health workforce challenges, will move us in the right direction. It will take us to a future where we have the right number of healthcare professionals in Alberta and in the right places, which will ultimately lead to better healthcare for all Albertans, ensuring that they get the care when and where they need it. So once again, thank you to Minister Nicolaides, the Advanced Education, and thank you also to the deans of the schools of medicine, both at U of A and the U of C, for making the proposal so we can fund this and we can actually get more doctors to where they're needed. So thanks so much for your time.
Thank you, Minister Copping. And thanks to all of you again for joining us here today. Together with our friends and colleagues at the University of Calgary and across the province, the University of Alberta is honored to receive this funding. This boost in support is a significant step towards allowing our medical school to address one of our most pressing collective missions, and that's to increase access to the very best in healthcare in even the farthest reaches corners of our province. Our mandate here at the University of Alberta is to serve the healthcare needs of not just our city, but of all Albertans. And we're committed to that. And we're committed by expanding into the rural and Indigenous communities, as you've heard Minister Copping speak about, many of which are in some of the most remote places within the province. This funding will help us to move toward making this vision a reality, not just in the north, but throughout the entire province, with an increase in the number of available spots for future doctors to embark on their medical degrees, with more spaces for these students to pursue their medical residency training once they obtain their degrees, and with more support for busy physicians who are critical to training the residents in particular, and to expand the number of academic clinician positions that we have to support the academic mission. We can build on our already robust network throughout the province and begin to fill the urgent needs in all corners of our health system. When coupled with the equally important expansion of training opportunities for nurses and other healthcare providers, the planned increase over the next 3 years will advance our health system. And this funding will be key to bringing all of us that much closer to our most ambitious goals. And with this important investment, we can continue to develop and enhance our cross-province partnership of health professional training opportunities. And today we're investing in the future of each and every citizen in the province and moving towards making our vision of equitable access to healthcare a reality. So thank you again. And now I'd like to welcome Dr. Todd Anderson to the podium.
Well, thank you very much, Brenda. It is my absolute pleasure to be here today. Thank you to Ministers Nicolaides and Copping, and for the great partnership that they have shown with Brenda and I over the last year or so. The thing about going last is there's really not much else to say. All the good things have been said. We are absolutely thrilled with the funding announcement that you'll see today. As Dr. Hemmelgarn noted, is that health workforce shortages are critical, something that we've been thinking about for a long time at the universities and in consultation with our colleagues at Alberta Health Services and the ministries, is that this is a critical issue for us at the present time. This is not a new problem. This is not a problem unique to Alberta. This is something that's seen in every jurisdiction, and if the solutions were easy, it would have been fixed. However, the funding that we've seen today will look at a multi-pronged approach to meeting the needs of Albertans, both in the large cities and rurally. And to summarize what we're going to use this funding for in consultation with our leaders is to, number one, increase the number of preceptors that we have both in the cities, but more importantly in our rural areas. That allows us to train more medical students in the rural areas and residency positions to allow them to do their full clinical training there. When we do that, what we know is that they will stay in those areas. This creates great opportunities for our rural students and our Indigenous students who might find a career in medicine much more appealing if they can stay closer to home than coming to the large cities. We think that's a really important aspect of this. We're also going to build these regional training centers and hubs that'll be the nidus for patient care, but also for delivery of educational aspects right from medical students through to their final year of clerkship and into their residencies. And we think by doing that, we will allow those individuals to stay in rural Alberta and meet the needs of our province. These models set up very nicely for multidisciplinary care. Physicians are an important piece of this, but these clinics will allow us to work with our nurse practitioners, with physician assistants, with occupational and physical therapists, with social workers, etc., pharmacists. All of these groups will work together to improve the quality of care for all of our individuals. So this is absolutely pivotal funding. We're thrilled to work closely with the government around this, and we think that this is a new beginning for us in Alberta to meet the needs of increasing the number of physicians and other allied health professionals for the workforce shortages that we have. So my thanks to the government, thanks to my colleague, Dr. Hemmelgarn, and we're thrilled to move forward on these initiatives. Thank you very much.
Thank you, Todd. That was very nicely summarized. So thank you again, all of you, for joining us here today and for our commitment to a shared vision of better health for Albertans. My thanks again to the speakers, to Ministers Copping and Nicolaides, and to all of you for joining us today. So we'll now take questions from the media. I'm going to hand over to Sam, who's going to moderate the question period.
Hidden in the
you.
back a little bit here, but thank you very much, Dr. Hemmelgaard. We'll now go into the media Q&A portion of this announcement. We'll be doing one question, one follow-up per outlet today, and we'll be starting with on-topic questions in the room. So if there's any media in the room here with a question, there's a mic just to the right side of the cameras here.
I'll just ask it.
Go for it.
Is this permanent funding? Like, what happens after this money is finished? Is it going to just reinvest itself, or is it just a one-time shot? Because how does that all play out?
Sure. Well, of course, the Legislative Assembly needs to pass and approve a budget every single year. And when the government does that, when they pass a budget, we also include a 3-year fiscal plan to give line of sight over the next 3 years about what the government's priorities are. So that's kind of the maximum range that we can provide within the financial environment that we have and the fiscal rules that we have. It's our intention to complete that and fulfill all of the commitments that we've made, and that's why the announcement that we've made today is for the 3 years. It's I can't say what'll happen in future years and if there are different decisions made with respect to budgets, but I would want to see that continue on for sure.
And is there enough professors to teach all these incoming students?
Yeah, maybe that's a great question. I know you're looking at the deans, and they might be the right people to answer this question. Yeah, yeah.
There's an influx
Of course.
Students.
Yeah.
Will there be enough teachers for the students to get them to where they be?
Yeah, I know we're looking at an expansion of seats as early as this upcoming academic year. New seats coming online for the 23-24 academic year starting in September. So I'll let the deans answer that in more detail, but I have full confidence in their proposal.
I think that's a great question. The number of teachers we have available is a rate-limiting step, but I think the funding will allow us to have individuals that are paid in alternate ways that will allow them that protected time to teach and lead programs for evaluation. So we're very confident that with a little bit of lead time that we can find these individuals within our province, and that we would set ourselves up for success by having those individuals on board. So the short answer is absolutely.
And how confident or how on the wish list would you like to have this keep going on past the 3 years?
Of course, we'd love it to continue permanently.
Like what do we do if after 3 years it's not renewed? I mean, is there the risk of brain drain, leaving and going other places? I mean, the race is on right now with all different provinces and even internationally.
You bet. So I think that because we have a need going forward is that we would love to see permanent funding for these additional seats, residency positions and salaried positions. So from Brenda and I's point of view is that we would view this as the start. We're going to make sure that this is successful so that the government would love to fund us into the future.
Perfect. And would any of the ministers like to hop in there as well to answer that last question?
Just to follow up with Minister Nicolaides. So again, we can only budget for the 3-year period, but this is a long-term investment. In an ideal world, we would have done it earlier because we have a shortage now. But the best time to start, when you haven't started already, is now. And so we're doing that, and we're investing for the long term to be able to make sure that we have the supply of doctors, particularly family rural physicians and other specialists where there's shortages, and we have this for the long term. And that's one part. When I look at our health workforce strategy, one pillar of that is long-term planning, right? To ensure that we have the resources that we need to deliver. And we can and train our own and keep them here, and particularly in rural areas. So that's an important part of it. So again, can't make commitments longer than the 3 years, but I am hopeful that we'll continue on this because, quite frankly, we need to. And part of our strategy will be able to identify, the needs in the future and how we can make sure we can meet those needs.
So this funding is locked in for 3 years.
Correct. It's part of the 3-year plan. We pass budgets every year. That's just the normal process as part of the 3-year plan. But quite frankly, our intent behind this is to build capacity within our schools to be able to do the training and maintain that capacity over the long term so we can actually provide the needs for Albertans.
Perfect. And we'll go to Lily from the Gateway now for a question. I don't know if you want to move your way to the mic or not, just so people online could hear you. Thank you.
Yeah, you guys were just talking about the long-term plan. I was wondering, what's the short-term strategy to help with these gaps in healthcare right now?
So I can start. So it's you're quite right. This is a long-term plan. But medium term is we announced today, especially for doctors, is increasing the residency spots for international medical trained graduates. And then short term is and those IMG spots are for individuals coming, doctors coming from other countries who need to do more training. Right, so that actually can expand that, and we're looking to expand another 30 positions. We already fund 40, so expanding an additional 30 positions, and we'll phase that in over time. In addition, we are out currently canvassing for doctors, welcoming doctors around the world. The College of Physicians and Surgeons of Alberta are streamlining their process to be able to recognize their credentials. So, for example, when you take a look at from certain countries like the UK, like South Africa, where they're comparable, we're shortening the process so that they only need to do a 3-month practice assessment, and then they're basically straight on the roster. So we're actually doing this right now. And for example, you look in Lethbridge, where there was it's an area with the concern of family physicians. Over the course of the last 10 months, 17 physicians. Now, this is some from within Canada, but the vast majority from around the world have already committed. They're going through their assessment. Over 10 of the 17 are already working, and over the next few months, we'll get the remaining doing. So the short term is leveraging immigration. The other key point of short term is making sure that we have people working to the maximum scope. So this is, Dr. Anderson mentioned this, a team-based approach. So it's not just about doctors, it's nurse practitioners, it's physician assistants, it is pharmacists, right, who have the largest scope in the country here in Alberta, who can have the ability to write prescriptions, have the ability to extend prescriptions. So it's leveraging the whole team short-term to ensure that Albertans get the care now while we expand our overall capacity and then change our models of care.
Thank you. And did you have a follow-up, Lily? No. Perfect. And seeing no more questions here, just for clarification, or?
Yeah. So you talked about nurses, international students, nurses, bringing them back to speed. I've talked to a doctor who was from South Korea, and she said it was like winning the lottery when she could actually re-certify here. There's a lot of doctors here that are not certified. Is there a program in place or coming to expand that program to get some of these skilled up to speed to basically win the lottery twice, I guess, for lack of a better term?
So the short answer is yeah, that's what the IMG, like the increase. So for many doctors who are coming in who are not deemed at the same level, so like the UK, for example, they often have to go through a residency process. So what we just announced today, increasing it, like there's 40 seats right now, increasing that by 30 is a pathway for them. In addition, working with the CPSA, the College of Physicians and Surgeons, a clinical or surgical assistant program to enable foreign-trained doctors while they're waiting, because sometimes you can't get in, but there's also a recency effect. So you need to stay in the field to enable them to continue to work in the field while they actually get through the additional training. So all of that is in play right now.
Yeah, just to add to that, also from the aspect of internationally educated nurses. So a part of what we announced today and that we had announced a couple months back was creating more bridging programs for internationally educated nurses. So when an internationally educated nurse comes to Canada, they have to have their credentials assessed, and then based on that assessment, they may have to participate in a bridging program. Then that can take 10 to 14 months depending on where their skill level is at. And we had heard when we made the announcement at Mount Royal University, as an example, there was a student there, an internationally educated student from Lebanon. She said she waited 5 years before she could get into the program because of such a long wait list. So by some of the announcement that we've made today and previously, we're going to create more bridging spaces so those individuals can get their credentials assessed, and if they need to go back and do a bridging course, they can get in, they can do it quickly, and operate at their full skill level.
Perfect. Thank you. And now we'll go to the phones. Operator, could you put through the first caller, please?
Thank you. Janet French, CBC.
Hi there. By what year will a medical student be able to do all of their training in Grand Prairie or Lethbridge, respectively?
That's an excellent question. The question is, by what year will they be able to do their training in these rural or regional training hubs? Right now, we're actually working on a proposal to address that very question. We have to ensure that the individuals are there to educate them, that we have the infrastructure and resources available in those regional training centers for the full scope of training to actually be completed. So we will know more within the next few months with respect to that. We also then have to get the sites accredited by the national accrediting body before we can deliver the full program in a regional training site. So it does take a bit of preparation, and that's the work that we're doing right now, and that was announced about a month ago with funding from Minister Nicolaides and Advanced Education.
And did you have a follow-up, Janet?
I do. So I'm trying to understand how far these increases go to keep up with population growth in Alberta. At the end of the 3 years for doctors per se, will we be any closer to having a better ratio of doctors per Albertan, or is it even going to keep up just with the growth in the Alberta population?
Other comments from colleagues. So this is going to be initially like a 33% increase, and then heading actually towards a 50% increase in the programs. But as indicated, there's multiple streams that we have here. So it's not only increasing at U of C, U of A in terms of undergraduate, and then the funding on top of that for residencies. It's also increasing the spots for IMGs. Plus, we also, when we start to, and this is just talking about doctors, plus we're also increasing continuing to increase practice assessment. So we have multiple streams, and the nature of the work is going to change. So just, because you have to look at efficiencies, and just because of what a doctor does today, as we move towards more team-based practice, you'll be able to expand the number of panels that the family team-based practice look at than a traditional, more a doctor focus, and changes the model of care. So this is a longer question, is that this will, these approaches that we're announcing here today will help expand our overall workforce and expand our workforce, faster than we have today. Like, because you look at we're talking 33% to 50%, in terms of this, expand the workforce faster than, because we don't have that level of growth in the population. But it's not the only source. But also, as we're looking at different models of providing care and improving, it's the more team-based approach, then we'll actually improve the care that Albertans get. And again, our objective, and this is, we noted in the health workforce plan, our objective is to ensure that every Albertan has access to a medical home. And it's not just about doctors, well, they're a critical part, but it's about all of the healthcare professionals. And the announcements today is, even though we're talking a lot about doctors at U of C and U of A, it's not just that. It's about nurses and other allied health professionals that Minister Nicolaides mentioned.
Yeah, maybe. Yeah, and just on that point, just to supplement in terms of other healthcare professions, we've taken a close look at an analysis and forecast from Treasury Board and Finance, the Ministry of Jobs, Economy, Northern Development, and others, and they consistently put forecasts together regarding labor shortages and projected labor shortages. And we've been looking very carefully at the projected healthcare shortages by 2030. And with a lot of the investments that we've made in budget 2022, as I mentioned, we're creating 10,000, just in that budget alone, 10,000 additional spaces in high demand programs, and we're continuing that in this budget. We're no longer projected to have a shortage of healthcare aides by 2030. The projected shortage of nurses has decreased substantially because of the new investments that we're providing and the creation of additional seats in many of those other healthcare areas, as Minister Copping mentioned.
Thank you, Janet. And operator, could you put through the next caller, please?
Thank you. Emmanuel Prince, Radio Canada.
Hi. My question is for either Minister Copping or Nicolaides. I don't really know who that falls into, but just to make sure all of the investments you announced today is only in operational funds. So you won't be building new classes to host these new students. It's only to like have a bigger payroll and bigger to pay the physician who trained the other physicians, right?
We'll make this one easy, short and answer. Yes, that's correct. All of the funding will go that we've announced today is primarily for operational dollars.
Okay. And the other thing is, even if the students can go to their residences in rural areas, for now they will still only be able to train in urban centers like Calgary and Edmonton. What makes you think that someone would want to go in a rural center if they're already living in an urban center for studying?
Sure. Well, I'll let one of the deans answer that, but I can just say, from my perspective as Minister of Advanced Education and visiting many of our different communities and talking to people in different communities across the province, there is an interest and to have training opportunities at home in their respective communities. That is something that I do hear quite a bit from Albertans from all corners of the province, as they are looking for more training opportunities close to home. But I'll let the dean give you more specifics.
So it's a very important point. Currently, in both the north and the south, we train between 15 and 20 residents per year. They do all of their residency training there in family medicine. What we want to do is dramatically increase those number of opportunities, not only for primary care, but generalist specialists as well, general surgeons and psychiatrists, obstetricians, and we want to be able to have more medical students training rurally as well. So we feel that if we can increase the number of preceptors, set up these regional training hubs, and have more people training in those locations, is that the vast majority of them will stay rurally. But you're absolutely right, is that if people stay in large cities, they're more likely to stay there. This initiative is really meant to fast track and increase the number of those rural training positions.
Thank you. And operator, do we have any more callers on the line?
There are no further questions in the queue.
Perfect. Thank you. That'll conclude today's announcement. Thank you, everyone, for joining us.